I know that everyone's very interested in what our latest case count is. And so as of 3:30 p.m. Today, our latest case count here in Fresno County is 82 cases. We've also had questions about the testing delays. Again, a source of constant frustration for us. What we've been told is that some of these tests are taking sometimes 9 or even 14 days to come back. That's really rare. Actually, that's not every single test. Most tests are taking somewhere between 3 and 6 days to result. But we do hear about these extraordinary long delay times, which obviously no one is happy about. And it's hard for us to track down every single test delay from the public health perspective.
Two-part question on test kits.
Yes, sir.
The FDA just approved a couple of quick response test kits as of last Friday and then Monday. So it's Abbott Labs and then the other one, Body Sphere.
Yes, sir.
Do we have any of those in Fresno County? Are they coming here? And if we don't, I also understand Abbott Labs has a larger system that can process 470 tests in a 24-hour period, mostly at community hospitals. Do we have that at least?
That's a great question. So I have to say, I'm cautiously optimistic that our testing capacity is actually going to improve in the next few weeks. Unfortunately, I don't think it'll be sooner than that because it takes time to acquire these technologies, and then we actually have to test them and make sure that they're quality controlled before we can actually start to ramp up the capacity for the testing. So that's already being done at several of our local area hospitals, and all I can tell you is that some of our hospital partners are actively pursuing a lot of these testing strategies so they can get them in-house. And that includes the rapid PCR that has already been, that's really what we're doing mainly right now, but also these newer technologies like the Abbott Lab technology. The other one that you mentioned, the Biosphere, I believe that is an antibody-based test. So that's going to be a different kind of test, but I'm also very excited about that because that's how we're going to find out that someone has actually got the infection and then gotten better from it. And those people, obviously, we're going to be very happy for them, but there's also the chance that they can actually become donors for their antibodies to help other patients. That's already been demonstrated with very small scientific studies in the international setting, but that's the kind of therapy that people are actively exploring to help as one of the drugs that might help with the COVID infection. So those are all things that people are exploring. All I can tell you right now is that I know that some of our medical partners in our hospitals are actively pursuing acquiring those technologies, and I'm sure they're actually going to tell us whenever they're ready to go online with those.
So how many total test kits do we have in the county right now? I'm assuming we don't have any of the new fast track ones. How many do we have total?
That's correct. So basically, when you say test kits, those have multiple components. What the doctors and the patients actually do in the, like say, for example, one of the drive-through clinics that we have here around town is that there's actually it looks kind of like a Q-tip, but it's like a medical version of that. And then they actually swab the person's either nose or throat. And then that is actually sent into a special vial over to a lab, which then uses different chemicals and reagents in order to do that PCR test. And so when you talk about test kits, it could be as simple as just the swab itself, or it could mean actually the reagents and the vials and everything else that it takes on the lab side to actually run that test. That's a pretty complicated process. So when you ask how many test kits there are, I can tell you that there's hundreds that are being deployed. We're doing a drive-through appointment only testing site here at Public Health, and we have lots of other medical sites all over the county that are doing similar models, and we're trying to get them supplied as much as possible. So, we're trying to meet the demand as much as we can. Sometimes these test kits don't arrive on that same day, so there is a little bit of a delay, but I feel like we're matching the demand as we see it for the test kits themselves.